Next, we'll call up, I see Assemblymember Bloom, agenda item number 5, ABX 210, local taxes, authorization, cigarettes, and tobacco products. Welcome, Assemblymember Bloom. Whenever you're ready.
Mr. Chair and members, I'll speak slowly while advocates come up, but I am here to present ABX 210, a bill that allows counties to place local tobacco tax measures on the ballot for a public vote. The tax would only go into effect if a two-thirds majority of the voters approved, of course. Smoking continues to be the leading cause of preventable death in the United States, and at least 30% of cancer deaths and 87% of all lung cancer deaths are caused by smoking. Nationally, 1 out of every 5 deaths is attributable to smoking, and in California, 40,000 people lose their lives to tobacco-related illness each year, and tens of thousands of Californians struggle every day because of tobacco-related illness. Treatment for these ailments is often expensive. Medi-Cal spends almost $3.5 billion paying for tobacco-related illness. Despite this, California currently has one of the lowest tobacco taxes in the country.
Mr. Chair, move the bill.
Ranking 35th.
Thank you. We have a motion and a second.
Thank you. With an 87% tax per pack compared to the national average, almost twice that, $1.60. These rates in California have not been raised in over 15 years. And we know that tobacco taxes work. For every 10% increase in the price of a pack of cigarettes, there's a 4% reduction in overall cigarette consumption and a 6.5% reduction in youth consumption. And this is one of the reasons why this bill is so important, young people. The Surgeon General projects that without a major reversal in trends, 5.6 million youth aged 0 to 17 living today will die prematurely from tobacco use. Those are completely preventable deaths. And today it is estimated that 16% of high school students, 16%, are addicted to cigarettes. This is in spite of all the work we've done and the successes that we've had. I think it's an important point that we're not there yet. But 16% of high school students are addicted to cigarettes, and 1 in 4 use some form of tobacco. Though there's widespread education on the dangers of tobacco, availability and deceptive marketing continues to lure our youth to try these dangerous products. So this bill is an important step to fight tobacco addiction and tobacco-related illness, and will allow California counties to join over 600 local jurisdictions nationwide that have their own cigarette taxes or fees. These jurisdictions bring in more than $430 million in annual revenue and are working effectively to reduce smoking rates, again, especially amongst young people, and to decrease smoking-caused death, disease, and costs. Increasing the cost of cigarettes is one of the most powerful and direct ways to reduce smoking. Studies have shown that youth and low-income adults are especially likely to quit or reduce smoking when prices increase. No one is better equipped to know how to fight tobacco addiction on the local level than the voters themselves, and this bill allows the Board of Supervisors of a county to propose these kinds of measures to their constituents. The bill is a sensible measure to help counties deter tobacco use locally, and I urge your aye vote.
Thank you, Mr. Bloom. Witnesses in support.
Good afternoon, Chair and members. Lindsay Freitas with the American Lung Association in California. This bill, as was mentioned, would remove the current prohibition against counties passing local taxes and help prevent kids from smoking, improve public health, and help generate local revenue. Nearly 40,000 Californians die from tobacco-related illness each year, and smoking is the leading cause of preventable death in the United States, killing more people than alcohol, AIDS, car accidents, illegal drugs, murder, and suicide combined. As the Assembly member mentioned, tobacco taxes, whether at the state, federal, or local level, have been a proven and effective way to reduce tobacco use among youth in particular, a 10% increase leading to a 6.5% reduction in youth consumption. In California, we currently have 21,000 youth who start smoking every year, and over 440,000 kids under the age of 18 today that will ultimately die from tobacco-related disease. And by allowing counties to tax tobacco, we can help make sure they can take that step to ensure that these kids never start smoking and lower that number. Not only will this bill allow counties the opportunity to save lives, but also money. This bill will give counties a chance to pass a tax that will ultimately help save millions of dollars. Overall, tobacco-related disease costs Medi-Cal $3.5 billion a year. It inflicts $13.29 billion in total medical expenses in our state each year and $10.35 billion in lost productivity. These numbers are a huge burden to our state. On average, California families' tax burden from smoking-caused government expenditure is $745 per household. On a county-to-county basis, the cost of smoking varies from $374 per resident in Orange County to over $1,000 per resident in Lake County. And the total costs vary from around $300,000 in Alpine County, a total cost, to $4.4 billion in Los Angeles County alone. Of all these associated costs, all of these associated costs will decrease as the number of people decrease smoking. And this bill really gives counties the empowerment to help make that happen. Thank you.
Good afternoon. Tim Gibbs, American Cancer Society Cancer Action Network, and we're in support of this legislation because we think that local communities should be given a choice when it comes to going beyond state law to protect their citizens from the deadly effects of tobacco use. Allowing counties the ability to give voters a choice on whether a higher tobacco tax makes sense for their community is the essence of local control. One of the most pernicious tactics that the tobacco companies use in order to stymie legislation and ensure that no policies pass that result in fewer people smoking is to preempt local governments from passing tobacco control legislation. Their modus operandi is to pass a weak law at the state level where they wield more power and then prevent locals from improving on the weak policy. For the most part, California has a long history of resisting the tobacco companies' attempt to preempt local efforts to reduce smoking. The reason we're able to pass the nation's first smoke-free workplace law was because local efforts made that happen. Local communities have the ability to decide for themselves on whether or not they want to protect workers from the harmful effects of secondhand smoke. Across this state, communities acted, which eventually led to the state enacting minimum standards for smoke-free workplaces. Many communities have chosen to go beyond the minimum standards that the state has set. We've also resisted preemption in local licensing ordinances that give law enforcement the ability to enforce youth access laws. Unfortunately, the one area where the tobacco companies have been successful in preventing local communities from protecting their citizens has been in taxes. Nearly 50 years ago, California decided not to allow counties to levy tobacco taxes. With more than 600 jurisdictions across the country that can levy their own taxes, we want to give our 58 counties the ability to decide for themselves. This isn't a vote about raising taxes. This is a vote about establishing local control and stopping the tobacco companies from preempting counties from reducing smoking. We hope that you agree that counties deserve to decide for themselves, and we respectfully ask for your aye vote.
Thank you. Additional witnesses in support.
David Ford for the Association of Northern California Oncologists and the Medical Oncology Association of Southern California in support.
Vanessa Kahina on behalf of the California Society of Anesthesiologists here in support.
Lydia Bourne representing American Academy of Pediatrics in support.
Jerry Jaffe representing the California Chronic Care Coalition in support.
Jasmine Gordon on behalf of the California Black Health Network in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Justin Garrett with March of Dimes in support.
Kula Koenig with the American Heart Association, American Stroke Association, proud co-sponsors of this bill.
Sawait Sium on behalf of Health Access California in support.
Christina Romero, Planned Parenthood Affiliates of California in support.
Brianna Pittman, California Dental Association in strong support.
Alicia Sanchez representing the California Medical Association in support.
Tim Madden representing the California chapter of the American College of Cardiology in support.
Chair and Member Sean Southwell on behalf of the California Primary Care Association in support.
Terry Brennan on behalf of SEIU California in support.
Brandon Roberts with the Health Officers Association of California in support.
Dr. Donald Lyman, California Academy of Preventive Medicine in support.
Matt Reed on behalf of Breathe California and the Breathe California affiliates in support.
Thank you. See no additional witnesses in support. Witnesses in opposition. Please come forward. Whenever you're ready.
Thank you. Mr. Chairman, members, Dennis Sloper representing the California Distributors Association. We are the taxpayers. It's not the tobacco manufacturers. It's not the retailers. It's not the consumers. The tax is applied to distributors, many of which are family businesses here in California and would have trouble maintaining taxes in some over 50 counties if that were to happen. Also, It should be noted that there was local taxes up until 1967, and in 1967, the legislature and the League of Cities removed that because of the chaos it caused in the marketplace, and that there was casual bootlegging, in that you could be across the street in one jurisdiction and have a tax and not on another, and it became a problem, so which they moved it back to a state-only tax, which makes sense. In essence, it's a tax on the distributors, and that's a very small community of mostly family-owned businesses, and for those reasons, we oppose.
Thank you, Mr. Loper.
My name is Gregory Conley, again on behalf of the American Vaping Association. While this bill does not impact vapor products at the moment, would not give local counties the authority to tax them, I would still urge opposition. The speaker from the American Lung Association earlier, I applaud her for accurately noting that it is smoking that kills. It is smoking that results in 400,000 deaths plus per year. It is smoking that results in the cost to Medicare and Medicaid throughout this state. It is not smoke-free tobacco and nicotine products, some of which would be included in this bill, such as Swedish snus, which we have decades of evidence from Sweden on its effectiveness for helping smokers quit. While we don't advocate for that individual product, I advocate for any smoker to switch to any nicotine, smoke-free product, because they are all far less hazardous, whether it is the gum, patch, lozenge, or if it is snus. Smokers deserve options, and they don't deserve to be taxed possibly even more than they are on a pack of cigarettes for trying to get away from smoking. Thank you.
Thank you. Additional witnesses in opposition.
Mr. Chair, members, James Jack on behalf of the Cigar Association of America in opposition.
Peter Blocker at the California Taxpayers Association in opposition.
Thank you. Seeing no additional witnesses in opposition, we can go to questions and comments from members. Seeing Assemblymember Baker.
Thank you, Mr. Chairman, and thank you, Mr. Bloom, for bringing this forward. I struggle with this one a bit, and I find I find the points that have been raised by the opposition compelling, and in particular the market chaos that was caused, and also just making this become something that is almost an underground product, because you can use it more across borders depending on what the taxation policy is there, when our goal is, I think a legitimate goal is to reduce reliance on this product. So, can you just address some of the points of opposition? You may be doing that in your closing anyway, but I would value that. Thank you.
I'm happy to, and I'll allow the advocates to respond as well, if that's all right. I just don't see this as a significant problem. There may be different taxes in different jurisdictions, but wherever one goes to shop, one's going to pay the tax that's levied in that location. And if there's some people going to a different county to purchase, that doesn't change the overall impact of what we're trying to accomplish here.
Yeah, and more than 60% of smokers buy one pack at a time. I mean, the vast majority of smokers want to quit smoking. Buying a carton, driving to Nevada, driving, wherever, the next county over where you're from. It could be a long, long way from Alameda County to Contra Costa County, depending on traffic. So, most smokers don't want to make that commitment to buy multiple packs of cigarettes. They're going to stop at their local store and pay, the tax that's in their local community.
And Assembly Member, I challenge the notion that in 1967 the law was changed because of chaos. In 1967, the law was changed to provide a only statewide authorization in order to benefit the tobacco companies for the very reasons that we heard earlier. It is easier for tobacco companies to restrict the amount of taxation at the state level than it is at the local level.
Well, thank you. And I am imagining what I think is very possible, which is now perhaps someone buys one pack at a time. But if all they have to do is go from, say, Contra Costa County, San Ramon, into Pleasanton or Livermore and buy a lot more at once in order to avoid the tax, that is a concern I have. It's also somewhat more regressive as well. If someone can just manage to pay the tax, or the additional funds, wherever it is, they can do that unless they would rather go somewhere else and get them more in bulk. That's a possibility I'm thinking of. And I have a constituency that Many of my local towns are very aggressive against smoking, and I find it is perfectly possible for them to say, you're not going to do it in apartments, you're not going to do it in streets, and you're not going to do it in public anywhere. And so I was persuaded, I liked the idea of local constituencies being able to decide this. I'm a no vote today because I think there is this real possibility of just creating a very easy way for people to get around it, and it can create either it's going to be bulk purchases or even driving it a little bit more underground than it already is.
Thank you. We have a motion. We have a second. Assemblymember Bloom, would you like to close?
Thank you. Well, it sounds like at least one of our opponents sitting at the table here should have been in the support line, because I was hearing a lot of support for the notion of taxing these tobacco products that we're talking about here today. But I want to be clear on this. This is a very democratic measure. This allows democratically elected local government officials to choose by their vote to ask the voters by a 2/3 majority to enact an increase in tax. So there's a double layer of democracy here that we would be passing back to counties that we took away from them many years ago that will provide all the benefits that you heard from today. I don't talk about this a lot because it's a long time ago in my past, but I used to work as a young person in a tobacco and candy warehouse. And I could tell you at that time, when we didn't have technology to help with the system of paying taxes, it was really easy at that time. We used to just iron on. It was a way of applying the tax. The company would purchase what amounted to little seals that went on each pack of cigarette. And so you wrote a check to the State Board of Equalization as a distributor. This is at that time, it was not a complicated process. It was very easy. It hasn't gotten any more complicated for the industry. It has only gotten easier to provide the service that they provide as individuals. So this is not going to have an impact on small business, as has been claimed. This is something that is simple to apply, whatever county you might be in, and I ask for your aye vote. Thank you.
Thank you, Mr. Bloom. We have a motion. We have a second. The motion is due pass. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, no. Baker? Baker, no. Bonilla? Bonilla, aye. Campos? Campos, aye. Garcia? Garcia, aye. Levine? Levine, aye. Mays? Santiago? Santiago, aye. Steinnorth? Steinnorth, no. Stone? Thurmond? Thurmond, aye. Wood? Wood, aye.
The bill passes with a vote of 8-3. Thank you, Mr. Bloom. I see some member Nazarian here. Welcome, Mr. Nazarian. We are on to agenda item number 6, ABX 211, Nazarian cigarette and tobacco product licensing, fees, and funding. Mr. Nazarian, whenever you're ready.
Thank you, Mr. Chair and members. Since 2003, the Board of Equalization has administered the cigarette and tobacco products licensing program, which levies licensing fees on businesses that sell and distribute tobacco products in the state. Since the launch of the program, the fee has not changed for the last 12 years. It has remained as a one-time fee of $100 per retail location and an annual $1,000 fee on distributors and wholesalers. AB 11 modernizes the program by updating the licensing fee imposed on retail locations, distributors, and wholesalers. The bill establishes annual fees as $265 per retail location annually and $1,200 to distributors and wholesalers. In 2003 to 2004, the licensing fee generated $18 million, which at that time was sufficient to maintain the program. However, because of the retailer fee it being one time only, the cost to run the program has exceeded the revenue generated from the fee. According to the Legislative Analyst's Office, Between fiscal year 2005-6 to fiscal year 2013-14, annual expenditures averaged $7 million more than the annual fee generated. Board of Equalization estimated for fiscal year 2013-14 the program cost of $9.6 million and only generated $1.8 million from licensees. A lot of numbers here, but bottom line is there's a shortfall. We only generate $1.8 million, while the enforcement takes about $12 million. As a result, Board of Equalization requires payment from special funds that receive cigarette and tobacco tax proceeds to cover the administration cost of licensing program. It is evident that the lifetime retailer fee is not adequate to maintain a viable enforcement program, which is good for businesses as it stops violators from circumventing the law and competing with legitimate businesses. Speaks to some of the concerns that I heard before. A goal of the licensing program is to reduce illegal sales of cigarette and tobacco products, and with me are three witnesses to speak on behalf of the bill. Thank you very much for your attention.
Thank you, Mr. Nazarian. Since we have three witnesses, it'll be 2 minutes each, and we'll give you time indications. Please proceed.
Good afternoon, Chairman and members of the committee. Kula Koenig with the American Heart Association, American Stroke Association. Our goal at the AHA is to build lives free of cardiovascular disease and stroke. We know that smoking increases the risk of heart disease and stroke by 2 to 4 times. We are in support of this bill because it addresses a problem that has existed for far too long. The Board of Equalization does not have adequate funding to cover the cost of running the tobacco licensing program. By adjusting the fee structure as this bill proposes, the BOE would generate approximately $12 million, equipping the organization with the resources it needs to prevent untaxed distribution and illegal sales of cigarettes and tobacco. As Assemblymember Nazarian mentioned, the BOE has stated that without the proper resources, the organization would have a difficult time discouraging tax evasion, which could result in decreased revenues for the funds. They also noted that the lack of ability to enforce could jeopardize California's master settlement agreement payments if it is determined that California is not diligently enforcing its cigarette and tobacco product statutes. The bill simply asks tobacco retailers to pay for the cost of doing business in the state. Similar organizations such as the Alcoholic Beverage Control, their license is $13,000 as a startup fee, where we're asking here $265. This is fair and sensible public policy. I ask for your aye vote.
Good afternoon. Whitney Staniford on behalf of First Five California and the First Five Association. First, we want to thank Mr. Assemblymember Nazarian for his leadership on this important issue. The Board of Equalization's tobacco tax licensing administration and enforcement activities have increased by 700% over the last 10 years and now costs First Five an estimated $14 million in annual Proposition 10 funds. During this same decade, total First Five tobacco tax revenue have decreased by 30%. The $14 million cost of BOE administration and enforcement paid out of the First Five Fund is an amount roughly equal to the First Five County Commission's statewide investment in health access programs, including premiums, outreach, and enrollment, or it is roughly equivalent to their total investments in infant and toddler education and care programs. Clearly, there are many alternative and more impactful uses of these critical funds in line with the mandates of Proposition 10. AB 11 is a crucial step to resolve this cost to children's programs. Consistent with the intent of AB 71 in 2003, AB 11 would ensure that tobacco tax licensees bear the cost of ongoing licensing, administration, and enforcement activities and refocus First Five funds on their intended beneficiary, children ages 0 to 3 in California. Thank you very much.
Mr. Chair and members, Autumn Ogden with the American Cancer Society Cancer Action Network, also proud support of Assembly Bill 11. This bill is important because it will preserve critical programs by ensuring there is enough funding for the licensing program. In 2006, the legislature approved a budget proposal allowing the BOE to fill in the funding gap by siphoning from the 4 funding sources that receive money from excise tax: the General Fund, the Breast Cancer Fund, Proposition 10, and Proposition 99, which funds the Tobacco Control Program. The amount taken from each fund is directly proportional to the amount each fund receives. The Tobacco Control Program, the second highest of these funds, has saved over 1 million lives and has saved the state over $130 billion since it was first started. Unfortunately, the program is underfunded, in part due to this licensing program. It receives currently 17% of the funding recommended by the United States Centers for Disease Control and Prevention. The reduction means the reduction in funding means that the benefits of the program have also decreased. The money from these funds was voted on to create critical programs which support tobacco education and prevention and tobacco-related disease research. By allowing the BOE to continue to divert funding, tobacco excise tax revenue to cover their shortfall, we deplete the life-saving programs that of critical funding. By revising this program and supporting AB 11, sorry, we are able to cover the costs without having to pillage other programs. Thank you.
Thank you. Additional witnesses in support.
Mr. Chairman, members, Terry Brennan on behalf of SEIU California in support.
Megan Allred on behalf of the California Dental Association in support.
Vanessa Kahina on behalf of the California Society of Anesthesiologists in support.
Tim Madden representing the California chapter of the American College of Cardiology in support.
David Ford for the Association of Northern California Oncologists and the Medical Oncology Association of Southern California in support.
Jerry Jeffy representing the California Chronic Care Coalition in support.
Lydia Bourne representing American Academy of Pediatrics in support.
Jasmine Gordon on behalf of the California Black Health Network in support.
Justin Garrett with the March of Dimes in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Lindsay Freitas with the American Lung Association in California in support.
Sean South with the California Primary Care Association in support.
So Wyatt Sume on behalf of Health Access California in support.
Alicia Sanchez with the California Medical Association in support.
Matt Reed on behalf of Breathe California and the Breathe California affiliates in support.
Dr. Donald Lyman with the California Academy of Preventive Medicine in support.
Thank you. See no additional witnesses in support. Witnesses in opposition? Seeing none, we'll go to questions and comments from members.
Move the bill.
We have a motion and a second. See no questions and comments from members. Assemblymember Nazarian, would you like to close?
I respectfully I ask for a vote. Thank you.
Thank you. The motion is due pass to Finance. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Baker? No. Baker, no. Bonilla? Bonilla, aye. Campos? Campos, aye. Garcia? Garcia, aye. Levine?
Aye.
Levine, aye. Mays? No. Mays, no. Santiago? Santiago, aye. Stein North? No. Stein North, no. Stone? Aye. Stone, aye. Thurmond? Thurmond, aye. Wood? Wood, aye.
The bill passes with a vote of 9-3. Thank you, Assemblymember Nazarian. Okay, let's go next to item number 2. Mr. Stone, ABX 27, smoking in the workplace.
Title reminds me of a song from way back, but we won't go there. Thank you, Mr. Chair. Members, I am pleased to present AB X27, which is about smoking in the workplace. California has led the nation, or had led the nation, in its laws that protect its citizens from secondhand smoke. But unfortunately, a lot of those laws had left open some loopholes. Other states are getting ahead of us in our ability to protect against secondhand smoke. What this bill does is close some of those loopholes and ensure that more workplaces in California will be smoke-free. I do have witnesses in support, and I ask for your aye vote.
Thank you, Mr. Chair and members. Callie Hamft on behalf of the American Heart and American Stroke Association. Really excited about this bill that would eliminate loopholes in current law that allow for smoking in the workplace. There is overwhelming scientific evidence that secondhand smoke is a direct cause of heart disease, the #1 killer for both men and women in California and the nation. The U.S. Surgeon General's report in 2006 found that even brief exposure to secondhand smoke can have an immediate adverse effect on the cardiovascular system. Smoking costs the state of California $23 billion a year in both health costs and lost productivity, with $3.5 billion directly linked to Medi-Cal alone. In addition to the economic burden of smoking, there is a human cost too. Last year, 43,000 Californians lost their lives to smoking and tobacco-related illness and disease. Once the nation's leader in protecting workers from the deadly effects of secondhand smoke, California has fallen behind the national standard set by the CDC and is not considered a 100% smoke-free state. 26 other states and the District of Columbia provide greater secondhand smoke protection in the workplace than California. In fact, 1 in 7 workers report being exposed to secondhand smoke in the workplace in California. Low-income workers, young adults, and Latinos are more likely to be exposed to secondhand smoke at work. Exposure to secondhand smoke should not be a condition of employment. It is time for California to catch up with the rest of the nation. Every Californian deserves to work in a healthy environment and should not have to make a choice between a good health or good job. We have the opportunity to do that today, and I respectfully urge your vote.
Thank you. Additional witnesses in support.
Chairman Bonta and members, Terry Brennan on behalf of SEIU California. The argument is simple here. No one should have to, as a condition of employment, risk their health and risk their life. We work with a lot of public safety folks who do it knowingly. The average worker shouldn't have to suffer the same fate. So we urge your vote on the bill.
Mr. Chair, members, Sarah Flocks from the California Labor Federation. We helped to enact restrictions on workplace smoking in 1994. Now is the time to close the loopholes in that original law so that we protect worker health and safety. We urge your aye vote. Thank you.
Thank you. Additional witnesses in support.
David Ford for the Medical Oncology Association of Southern California and the Association of Northern California Oncologists in support.
Tim Madden, representing the California chapter of the American College of Emergency Physicians in support.
Betsy Armstrong with the County Health Executives in support.
Vanessa Kahina on behalf of the California Society of Anesthesiologists here in support.
Jerry Jeffy, representing California Chronic Care Coalition in support.
Megan Allred, representing the California Dental Association in support.
So I assume on behalf of Health Access California in support.
Lindsay Freitas, American Lung Association in California in support.
Gregory Kramer from Planned Parenthood Affiliates of California in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Alicia Sanchez with the California Medical Association in support.
Lydia Bourne, American Academy of Pediatrics in support.
Justin Garrett with the March of Dimes in support.
Sean South with the California Primary Care Association in support.
Jasmine Gordon on behalf of the California Black Health Network in support.
Matt Reed on behalf of Breathe California and the Breathe California affiliates in support.
Brandon Roberts with the Health Officers Association of California in support.
Tim Gibbs, American Cancer Society Cancer Action Network in support.
Dr. Donald Lyman from the California Academy of Preventive Medicine in support.
Thank you. See no additional witnesses in support. Witnesses in opposition. Please come forward. Let's make some space for our witnesses in opposition, please.
Mr. Chairman and members, James Jack on behalf of the Cigar Association of America, the National Trade Association representing the cigar manufacturing industry. Our association has an oppose unless amended position on this bill. We are asking for a relatively minor amendment to exclude the prohibition of smoking in cigar retailers and private cigar lounges. Oftentimes, cigar smokers prefer not to smoke at home because they do not want to expose their families or their children to secondhand smoke. Cigar lounges provide an environment for cigar enthusiasts where they can enjoy each other's company in a venue that non-smokers do not frequent and where minors are not allowed. The Cigar Association of America has no quarrel with the remainder of the prohibitions in this bill, but would ask for the author's consideration and the committee's of that minor amendment in order to remove our opposition. Thank you.
Good afternoon. Again, my name is Gregory Conley with the nonprofit the American Vaping Association. Now that you have passed through the earlier tobacco bill making the use of smoke-free vapor products smoking, it is critical that the amendment that the person from the Cigar Association advocated for also be passed, because vape shops all throughout California, if this amendment is not put in, would be unable to allow people to sample products to see what flavor will help them get off of cigarettes, to test the product, to see exactly how they work, to troubleshoot, to get problems done by trained employees. That will all go away if that amendment is not put in. I also want to speak to one of the exemptions that you're removing. Seems especially silly in the context of vapor products, which is the only thing that we are speaking on. Banquet rooms. I was just at an event, ECC it was called, in Pomona, with thousands of vapors with exhibiting vapor products, age restricted, etc. That event is now banned in California if the prior bill goes through. But we had a private function afterwards for about 50 people, 75 people, and vaping was allowed in the banquet room of the hotel. That will no longer be the case if this exemption passes. I would also urge you, in California, there's an exemption if this amendment is put in for retail and wholesale tobacco outlets. It is very unclear because California's never really had a cigarette manufacturing industry as far as I know. Vaping, meanwhile, you have possibly hundreds of businesses throughout California. They manufacture in professional labs, but they do not have retail or wholesale storefronts. So the question is, if I am a manufacturer and I have made new e-liquid in my facility filled with only employees who vape, do I then have to step outside to try the product to determine if that's something that I want to make? It makes no sense. It's very unclear. So you have these manufacturing facilities. They should be welcome. They are providing good jobs. Some of these people, 50, 75 people they employ with health care. But you may send the people that are creating the actual, doing the actual manufacturing outside to do product testing. It just doesn't make sense. And it may make sense for cigarettes because they would harm the employees around them. But with vapor products, especially if you put in something about ventilation, there's no harm in a manufacturing facility to be able to use them. And thank you for your time.
Thank you. Additional witnesses in opposition?
My name is Matthew Villarreal from Los Angeles, California, and I strongly oppose.
My name is Kirsten Sherholt from Burbank, California, representing Vape Verde, and we strongly oppose this bill.
Bobby Williams, local business owner, Vapor 93. I strongly oppose as well.
My name is Joshua French, owner of Visalia Vapes. I oppose this bill.
Jonathan Thomas with Flawless Manufacturing Distribution, and I oppose this bill.
Kyle Runs from San Jose, California, and I oppose this bill.
Edward Wolf, oppose this bill.
Daniel Salazar, owner of Cyber Liquids. I oppose this bill.
Chris Battenscheid with Cyber Liquids. I oppose this bill.
Ryan Zarinsky with Cyber Liquids. I oppose this bill.
Brian Macias with Cyber Liquids, and I oppose this bill.
Mark Rodriguez, Fresno, California, Cyber Liquids. Oppose.
Oscar Covarrubias from Fresno, California. I strongly oppose.
Robin Pennock from Elevate LLC in Vallejo, California. Oppose as it stands.
Randy Furr, Seal Beach, California, Boat Industries. I oppose this bill.
Thank you. Seeing no additional witnesses in opposition, any questions or comments from members? We can entertain Assemblymember Bonilla.
I was just hoping to get a response from the author on the cigar lounge issue that was raised.
Yeah, we're working with the Smoke-Free Alternatives Trade Association on the issue that was brought up on amendments to get the opposition removed, and that is the issue of private smoking lounges and retail tobacco shops.
And you agree to do that?
Yeah, we're working on an amendment on language to do just that.
Okay.
I'll move the bill.
We have a motion. We can entertain a second. We have a motion. We have a second. So no additional questions or comments from members. Would you like to close, Mr. Stone?
I ask for your aye vote.
Thank you, sir. The motion is due pass to finance. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Baker? Aye. Baker, aye. Bonilla? Bonilla, aye. Campos? Campos, aye. Garcia? Garcia, aye. Levine? Levine, aye. Mays? Mays, no. Santiago? Santiago, aye. Steinnorth? Steinnorth, no. Stone? Stone, aye. Thurmond? Thurmond, aye. Wood? Wood, aye.
The bill passes 10-2.